Hi, and welcome to the Lyme Bites podcast, where we shine a light on the misunderstood science of Lyme and other vector-borne diseases, as well as the truths that many still miss. I'm Dr. Mariah Hinchy, naturopathic physician and fellow of the Medical Academy of Pediatric Special Needs. I specialize in treating chronic Lyme disease as well as other complex inflammatory conditions. In this podcast, we break down what's working and what's not. We share the facts that most people miss, we challenge outdated thinking, and we give both patients and practitioners the tools to heal smarter. So let's get into it and change the way we heal Lyme. Welcome back to Lyme Bites, rebuilding immunity, reversing inflammation, and redefining recovery. Today, we're diving into one of the most misunderstood and controversial conditions in medicine, Morgellons disease. Often dismissed as delusional or psychogenic, Morgellons is now being recognized by a growing number of clinicians as a physiological manifestation of chronic infections, including vector-borne diseases like Borrelia, Bartonella, and Babesia. Our guest today, Dr. Ginger Savely, is one of the world's foremost experts on Morgellons and a leading clinician in the treatment of complex chronic vector-borne infections. Based in Washington, D.C., Dr. Savely has dedicated over 2 decades to the care of patients suffering from Lyme disease, Morgellons, and other stealth infections. She's the author of Morgellons, The Legitimization of a Disease, which is a groundbreaking book that brought scientific credibility and compassion to a condition long dismissed by mainstream medicine. Her pioneering work has been instrumental in demonstrating that Morgellons is not psychiatric, but rather an infectious multi-system illness associated with immune dysregulation. Today, we'll explore what Morgellons truly is, what's happening at the cellular and immunological level, and how it can be effectively treated. We'll also talk about the emotional and psychological impacts on patients who have been misunderstood for way too long. We'll also talk about what healing looks like when both the infection and the person are finally seen for what they truly are. This is Lyme Bites. Let true healing begin. Welcome, Dr. Savely. Thank you so much for joining us today.
I'm happy to be here. Thank you for asking me.
It's my pleasure. So, for our listeners that might not be familiar with Morgellons disease, how would you describe it clinically?
The very unusual thing that these patients have is they have a sensation under the skin of crawling, biting, stinging, but that in itself isn't a terribly unique thing because other illnesses can cause that. But they have spontaneous lesions that break out, and most significantly, filaments that come out of their skin that can be black, white, blue. We've even seen orange, purple, red. We've seen all the colors of these filaments that come out. They have other unusual things that come out of the body, too, that look like seeds and some that look like fuzz balls. And there's so many unusual things that come out of the body. The patients normally have also a lot of systemic symptoms. And those symptoms are very familiar to a Lyme audience because they're the symptoms of Lyme and co-infections for most of these people. But I'd say the distinctive feature is the filaments, because in my book, in fact, I compared this disease to a lot of other dermopathies, and there was only this one distinct feature that made it very distinguishable, was the presence of these filaments. Otherwise, any other symptom they have can be attributed to something else, But that's pretty much diagnostic right there. So when they come in and I can see those, and you have to use magnification. Very rarely can you see these with the naked eye. And at least 60x magnification. And then you see these unusual fibers and just tangled up underneath the skin. But the most unusual stuff. I mean, it's just, I've been looking at it for 25 years and every day, I'm just amazed by what goes on with these folks. They're very unhappy people.
So I've had a few handfuls of Morgellons patients who've come to me not knowing what they had over the years. And almost every single one of them comes to me thinking that they have some sort of microscopic bug
Right.
infestation. Do you see that a lot too? I've had patients come in with bags filled with tissues where they think, that they've captured the actual bug that was biting them and causing these sensations.
Yes. It's very, very typical, and I, often have a very hard time dissuading them of the notion that they actually have some sort of ectoparasite, something like mites or that type of thing. I'm not saying that some of these people may not also have an infestation. I mean, who knows? Some of them may, but with Morgellons itself, it's not an ectoparasite. We know that. We know it's not a worm. I mean, a certain amount of research has been done. So the thing that's confusing, and I easily understand why people think they have a worm or some sort of ectoparasite, is the sensations really confuse you because you feel biting, you really feel it. You feel stinging, you feel crawling, you all of these sensations, you are convinced you're infested with something by the sensations. And then you see these little black things and you're like, "Oh, these are some kind of tiny little mite." But when looked at under the microscope, well, under electron microscope even, they're just tiny curled up little fibers wound into a ball. But from our naked eye, it's just a tiny black thing. We don't know what it is, and a lot of people just assume that's the causative pathogen, whereas it's just more waste product or whatever you want to call it that comes from these patients.
Right. And I think one of the most devastating things, besides the fact that, most of them have been told that they're crazy,
Oh yeah.
they are so afraid to pass whatever they think this infestation is on to people around them or to their loved ones. And, they're afraid to be intimate and just,
It is.
I don't know, tell you, but you
Well, but yeah, but no, it's good that you're bringing that up because I feel like this is another thing, when I get a patient, probably you've just mentioned the 2 hardest things, to dissuade them of is, 1, that they're infested with an ectoparasite, and 2, that they're highly contagious. And I always try to explain to them like this: Y this is whatever causes this, and we still don't know, we really don't, it has to get into the skin, under the skin, with some sort of a bite or a thorn or splinter or something. So I said, just kind of think HIV. It's got to be body fluid to body fluid kind of thing. It's not going to be sitting next to somebody on the bus, or hugging somebody. It's possibly sexually transmitted. Um, we're not 100% sure, but we know that the fibers, the filaments are in semen and in vaginal fluid, so who knows? But, usually it's something getting under the skin, so that's why we've seen so many with flea bites, tick bites, cactus or rose thorns, splinters, or people being around really filthy things, like with a laceration. Like a lot of gardeners and if they don't wear gloves and their hands are in the dirt, I've seen it happen with that too. So something is triggering this, and I just I I've always felt that whatever pathogen is causing this is somehow manipulating the DNA of our cells somehow to do unusual things. Basically do the wrong thing at the wrong place at the wrong time. So our body produces keratin. Of course, we need that. We our nails and so the cells here should be producing a lot of keratin, but you shouldn't be randomly just producing it out of cells all over your body. And that's what we see happening here is that these it's shards of keratin or little skinny little thin filaments of keratin are just coming out in random places, and it causes pain as they try to get their way. People always say it feels like somebody's poking me with a pin, but from the inside out. And So that's part of the misery too, is all the pain that they have from that.
Right. And so you mentioned infections. So I know that you specialize in treating chronic vector-borne disease. What are the infections, including the vector-borne diseases, that you see most closely related to Morgellons? Are you ready to revolutionize your approach to diagnosing and healing complex chronic inflammatory illnesses in both adults and children? The Lyme Bites Symposium is your gateway to cutting-edge education, groundbreaking research, and innovative therapeutic solutions. Join us at the 2025 Lyme Bites Symposium, November 14th and 15th at the Fort Lauderdale Marriott, Pompano Beach Resort and Spa. Lyme Bites is the premier functional medicine conference on complex chronic infection-driven inflammatory illnesses. This year's meeting is jam-packed with leading industry experts discussing long COVID, mycotoxin illness, PANS pandas, as well as Lyme and other vector-borne diseases. This conference will arm you with the knowledge, clinical pearls, and practical solutions that you can implement immediately into your practice Monday morning that will literally change your patients' lives and get them on their path to true healing. So join us at Pompano Beach or virtually from anywhere. Register now at lymebites.com. That's LYMEBYTES.com.
Well, originally I published a paper. Actually, I was the first publication that ever mentioned the association between Lyme and this. And basically, I never for a minute was trying to suggest Lyme causes it. I was just saying, hey, look, this is showing up a lot in the Lyme population. And, what's the connection there, And since then, two other studies have been done in Australia and in San Francisco, where they found that 6% of a certain Lyme population ended up with Morgellons. So we don't know, whether the Lyme is immunosuppressant enough to make them more susceptible to whatever's causing this, or perhaps it's another co-infection, whatever is causing this, but I really don't see any indication at all that it's caused by Lyme disease. I mean, just because Lyme is present, obviously that doesn't mean it's the cause. Uh, I've always seen a closer association with Bartonella just because Bartonella has so many skin manifestations, and some of the skin manifestations of Bartonella are so similar to those of Morgellons patients, these red tracks that they get.
Right.
And when I treat a patient for Bartonella, that's when their Morgellons gets better. Now, once again, I'm always very careful to say this. I'm not saying Bartonella causes Morgellons. I have no idea what causes it. But I noticed that if I go after Bartonella and treat that, that's what helps these patients the most. So it presents an interesting question, like what could be, but there's so much we don't know in terms of pathogens, right? I mean, we know so little right now. Even 10 years from now, 20 years from now, we'll look back and laugh at what we didn't know. And so I don't even think we're close to being able to say yet what actually causes this.
So
But
you referenced the study that showed 6% of Lyme disease patients had Morgellons. Has anyone done a study to look at what percent of patients with Morgellons have, whether it's Bartonella or Borrelia or a different vector-borne infection? Has this?
I have. And that was my first published study.
Yeah.
And so I based it in two ways. I based it the diagnosis that I made on lab results, and as you and I both know, plenty of times a person can be a poster child for Babesia and have a negative test, right?
Right.
So I also had a clinical diagnosis. So I set up a list of symptoms that qualified a person for a clinical diagnosis for each of these. So when I say that 40% of my patients had Babesia, that doesn't necessarily mean they all 40% tested positive for it, but they, either tested positive or had florid symptoms highly suggestive of it. So anyway, that was the study where 97% of my Morgellons patients had Lyme disease.
Right.
Now,
Lyme disease or a co-infection.
yeah, yep,
Yeah.
yep. And I first sort of associated with the Lyme because generally speaking, most providers are kind of a little more familiar with that. The average provider really doesn't spend a lot of time thinking about Babesia or Bartonella, as we know. But yeah, and then some people argued with me and said that should have been 100%. But no, because I have seen over the years, I've had numerous patients that had no Lyme symptoms whatsoever. Tests were all negative, but they clearly had Morgellons disease. But they always had something else suppressing their immune system. I had an AIDS patient once with it. I've had several organ transplant people who are on immunosuppressant. I've had people with severe autoimmune disease where they had to live on very high dose immunosuppressants, have some of the worst cases of it. But these were not tick-borne disease patients. So clearly what they all have in common is they have immune challenges. All of these people have. And so that's what we need to discover more than anything. When we don't know a pathogen for an illness, hey, let's look at every other potential immune burden, right? And find out what those are, play detective, look for all of those, and try to mediate those problems. Hopefully, then the immune system will be able to take over and do what it should be doing. And that tends to work, most of the time. The only time it doesn't work is when I can't get a patient to really cooperate with me about the whole mold thing, because that's the other thing I've really found with all of these patients. There's a mold component. Once again, I'm not saying mold causes Morgellons. I got to be careful because, I get quoted sometimes. So I really want to make sure that I have no idea what causes Morgellons. But I do see a very close association with the mold, mainly because it's just such a big immunosuppressant. And when I check HLA-DR type on these people, 24% of the population, supposedly, according to the work of Dr. Richie Shoemaker, has this HLA-DR, a haplotype that says they are mold sensitive. And 100% of my Morgellons patients have that HLA-DR type. And they are all living in mold, or recently were living in mold and still toxic. So that always seems to come into play, and that has to be dealt with for them to get better. And some patients just don't want to go down that road because it is a pain. What if you find the house you're living in is so moldy and you're like, oh my gosh, what? It's huge. It's so difficult. What are you going to do? You're so sick and you're going to pick up and move, it's just horrible to even think of. But I think really to get people well, we do have to consider every single burden on the immune system. And unfortunately, that's a big one. It's a big one.
It's huge.
It is. And all of us that treat Lyme, I mean, when I started out specializing in Lyme and co-infections 25 years ago, in the background, we were hearing Dr. Richie Shoemaker kind of go, mold, mold. And we were all like, you know. And then the years went by, we just realized, oh my God, this is huge. This is why a lot of these people aren't getting better. And so it's the same with Morgellons, it's just, once again, it's just discover the immune burdens, try to take care of all the ones you can. And my patients with PTSD, really hard to get those people well, really, really hard. And I do insist that they be actively working on that, going to therapy, support groups, whatever, because those are some of my sickest people for sure. But, I just a little anecdote here. I just talked to a patient right before this. First time I talked to her, she was really out of it. And she's a Morgellons patient. So I just talked to her and she just seemed great. She seemed great. Her daughter was on the phone too. She said, you know what? Her primary had given her an antipsychotic because he thought she was delusional. and she felt awful because of the side effects of antipsychotic. And she's actually fine. She's healthy as can be, but she's one of my people who she's fine systemically, but she's got all these Morgellons symptoms. So not all of these people are neatly fall into this, have Lyme, have, all of those sort of inflammatory symptoms. Yeah, but they still have the lesions, they still have the fibers. So
Are you suffering from Lyme disease or another complex chronic illness and aren't sure who to trust when it comes to herbal supplements? Hi, I'm Dr. Mariah Hinchy, founder of Lyme Botanicals. As a naturopathic physician specializing in complex chronic infection-driven illnesses like Lyme disease, I needed herbal medicine I could truly trust. That's why I formulated Lyme Botanicals, where our herbal tinctures are handcrafted in small batches right here in Connecticut. We use the whole herb, never isolates, to preserve the full spectrum of medicinal compounds. Every single step from sourcing to extraction is done with precision to ensure maximum purity, potency, and consistency. These are the same herbal formulas I use to heal myself and have used for years to help my patients and family members heal too. And now I'm making them available to practitioners and patients everywhere. Lyme Botanicals, herbal medicine you can trust from a doctor who lives this work. Learn more at Lyme Botanicals. That's LYMECORE.com. So can you elaborate a little bit more? I know you said, we don't know exactly what causes it, but clearly there's a level of either immune confusion or dysfunction or imbalance at the heart of it.
yeah.
Can you tell us what's happening more like at the cellular level, like with the skin or with the production of keratin? Like, do we have any idea of like what the pathophysiology that's kind of going awry is?
Yeah.
These fibers are being overproduced.
You're asking the $1,000,000 question. And unfortunately, there's been minimal research, research costs money. We can't ever get money, and we've applied for grants to the NIH, and they say we don't support diseases that don't exist, that kind of thing. So it's been all volunteer, basically, the research, and that's when they found that the filaments come out of the body are actually the body's own protein, keratin. And so it's just always been my assumption that something has gone haywire in the DNA of the cells to make them, produce this enormous amount of keratin in places where it shouldn't be producing it. And the sensation people feel of they often talk about something's crawling underneath their skin. Well, we've seen those fibers do grow sideways under there too. So there is a feeling that they're having under there. But no, I don't. The in everything about the pathophysiology is still a mystery, and there's just so much we don't know, and it's very frustrating to me because we can't seem to get the people, CDC or NIH or anybody really interested in this. And so until we get some more research, we're just I'm just out here just trying to help people feel better. I mean, I don't claim to know more than anybody else about this. It's just I've been doing it more. I've seen a lot of these people, and I have learned a few things from them, from the patients, and from what we have tried over the years. That's basically all it is. It's just experience with these patients, but I still feel like I'm in the dark about most things.
Yeah, absolutely. And, to your point of people not really wanting to learn about this disease or treat it, it's like, yeah, I mean, there's some of the most difficult patients to treat, A, because it's misunderstood,
Right.
but B, because there's so much like trauma and so much gaslighting with these patients. They don't trust anybody.
If they didn't have PTSD before, they do now.
Oh, for
Because, oh my gosh, these people have lost all faith. in the medical care system. I mean, I can see why, I mean, it's awful, the gaslighting they go through.
Every patient that had come into me were told that they were literally delusional.
Yep.
They were diagnosed with delusional parasitosis.
Right, exactly. That's the most common diagnosis these people get. Sometimes, they might see a dermatologist that'll say, "Oh, you have prurigo nodularis," which is one of those many, I always kind of laugh about dermatology. They have so many diagnoses that are really just basically a name for a symptom complex. Hey, all these people have this, so let's give them a name.
Right.
So I don't even really think of those as true diagnoses, because they're just, let's call this a name. And a lot of people are misdiagnosed with that, with prurigo nodularis. And there's a lot of different misdiagnoses. Some of them are just diagnosed with scabies and given medicine for that, even though, if the person diagnosing it knew anything about scabies, they would never call this scabies because it's not in that typical pattern that scabies would be. But at least they're listening a little bit to people. That's one step better, right?
So, what other misdiagnoses do you commonly see, and how would you how do you help clinicians? Because we have a lot of clinicians that listen to this podcast.
Right.
How do you help them differentiate between Morgellons versus other dermatologic or psychiatric illnesses?
Okay, it's easy as pie. One thing, one thing, and that's just look for the fibers. Look for them. If they're there, they have Morgellons disease. That's it. It's the distinctive diagnostic feature. And, you can just diagnose all kind of other dermatologic diseases just looking at them across the room. But, come on, dermatologists are supposed to look at these things with magnification. The other problem is most dermoscopes that the dermatologists have in their lab coat are about 14x or something, and that's not enough. You really need a good 60x to see this stuff. And so even if they do think to actually look, which they rarely do, they usually diagnose it from across the room. They're probably not going to see what they need to be seeing. So anyway, it's a frustrating thing that these patients go through because doctors don't even give them. It's so disrespectful the way they're treated because they're not even really examined.
Right.
They say their symptoms and then they're just like, you know,
Yeah.
psych. And how can that happen? I'm very disillusioned with my colleagues that do that. I mean, it's so upsetting. These people are dear, wonderful people. Currently I have 100 of them, right about 100. And, we do an online support group and everything because I tell you, there's nothing, when you have a disease like this, there's nothing like the support. You just need it more. I mean, I think a lot of diseases you need support from fellow sufferers, but boy, Morgellons is one where you really do because almost everyone, a lot of these people won't even tell their own spouse that they have it because they're just nervous about what they're going to think. So it's a very it's like I feel like I kind of I don't have a choice. I mean, I can't just turn the other way and ignore these people and not help them. I mean, it's why would another doctor say to me that's irresponsible for me to treat with FDA approved drugs, by the way, but of course being used off label, that's irresponsible. Why is it not irresponsible to just ignore people suffering?
Or to throw them on a psych medication.
Yeah, or throw them on a psych medicine like this poor lady I just talked to. She was like a different person, and her daughter said, yeah, because she stopped that psych med that they put her on, and so anyway, I'm disillusioned by the way these people are discounted and not helped. And so my goal has always been the two things: to uncover all the burdens on the immune system, to help the immune system function at its best, And then also, honestly, just trial and error of different things. And they're all, FDA approved medications. It's just we're using them for a different reason. And, through the years, I've definitely found certain things that work better than others. And so I start with what statistically has helped the most people. If that doesn't work, we move on to the next thing. So there's a lot of things we try, and different things work for different people. And I've always suspected that's because of their particular unique immune burdens, So that's why I had a patient get so mad at me once because she'd been on antibiotics and wasn't helping. And then we put her on antifungals and she got completely well. But the next 20 people I did that with would not get well on the antifungals. And so that's the thing, people talk with each other. They'll say, this helped me. And they don't understand not everyone is you.
Right. There's not a one size fits all Morgellons.
Right. Exactly. And I mean, we know, you and I know that's true for tick-borne diseases in general, but I think with Morgellons even more so because I've had all kinds of different things work, for people, but it just you never know who's going to respond to what. So it's always been like, okay, let's try this. And luckily I've done it enough where I've treated thousands of these people where I kind of have my own little statistical bank of information. Like, okay, let's try this first because that works for a lot of people, So that's how it goes.
Let's talk through your treatment strategy. So, I would imagine in the beginning, there's a lot of reassurance, right? That it's not an infestation that's not going to transmit it. And then I would imagine that you probably cast somewhat of a broad net looking for vector-borne diseases, fungal burden, toxins in every part of the environment.
Metal toxicity is sinus, mold, or it just a little bit of everything. And a lot's going to depend on the individual, of course. The patient I was just referring to was put on the antipsychotics. She's as healthy as she can be, but she just has this skin stuff. So honestly, I'm not going to be inclined to put her on a lot of antibiotics. I mean, she's fine. She did a very thorough hygienics panel and really unremarkable, and she doesn't have any of those symptoms. So actually what I'm doing with her is taking her through a parasite protocol, actually Dr. Klinghart's, where we basically just run through pretty much most of the anti-helminthics, anti-parasitics. And then when they're finished with that protocol, I'll ask them, was there one that helped you in particular? And they always have one. Most commonly ivermectin, but runner-ups are albendazole and praziquantel. So sometimes it's those. And then they'll just go back on that one that was the most helpful to them. But then the other thing I try, especially if I assume that the person has had a lot of mold exposure, I'll treat them with something like posaconazole or itraconazole, because I have some cases where, oh my gosh, that's helped them tremendously right there, even with their Morgellons symptoms, And so but if I feel like there's some tick-borne infections, if the people really are systemically ill, some of these people can hardly get out of bed. So, they're just like our sick as Lyme patients. Then I'll start with a Bartonella treatment because that always works. And I just start the very, very basic. I start all these people on is just a sulfa drug, and along with either clarithromycin or azithromycin. And that's just the first step. And if a lot of these people, even when at their next follow-up, even those two things, they're already getting better. And then we'll just augment that by adding first rifampin, see if they tolerate that, then double the rifampin, see how that goes, and then we switch to rifabutin. And basically, my patients always say the rifabutin is the one that, not to be scientific here, but kicks butt better than anything. And that's the one, but it's also tough. Because what happens with the Morgellons people, just like with Lyme people, how they have a Herxheimer reaction, Morgellons patients, their form of Herxheimer reaction is a zillion things come out of their body, and it's overwhelming. They just say, I can't even believe it, how much fibers and other things are coming out of my body. But I've always told them, hey, good, because that means we're on the right track, because
Better out than in.
yeah, every time we try something and it causes a mass exodus, we're on the right track. And that's what eventually is going to help them. People always ask me, do you think it's good for these things to come out? And I say, I can only guess that it is good. Let's say it's good.
Well, with our skin being our largest organ of detoxification, I mean, it makes sense too, right? That we're pushing a lot of things out
Yeah,
through our skin.
right. And so that's kind of always been the goal, to get this stuff out of there. And for the topical lesions, and by the way, not every Morgellons patient has lesions. I have about 10 to 15% that have the sensations, have the filaments, all that, but they never get a lesion. And sometimes those people are told, well, you don't have Morgellons because you don't have lesions. No, that's not right. You don't have Morgellons if you don't have fibers, because that's the distinctive feature. But some Morgellons patients, lucky ones, don't get any lesions at all.
So, for our
And
listeners that don't know what you're describing, can you describe what you mean by lesions and like
yeah,
actually look?
what it looks like the most, and the very first time I ever saw it, the first patient who ever came in with this, it looks like somebody had a mosquito's bite and they just scratched the heck out of it.
Yep.
And so it's just this whole, sort of, abraded, ulcerated looking area, but the patient always says it appeared just like that. Because they're always accused when they go to the doctor, "Oh, well, you just scratched too hard on all those things." And they're all very emphatic about it. "No, this just appeared looking like that." And some of the worst ones can even look like cigarette burns or something, and they can be different sizes. Some of them are very small, but, these lesions usually do have those fibers inside of them. Just got a new picture. Yes, I get so many photographs from the patients where she's all excited because she just got some kind of a scope, and she, didn't even know she had fibers, because I always tell them, "Well, look for them because that's the distinctive feature, so you might need to get a little lighted magnifier to look for them." And she was shocked. It was, I mean, she just had a mass of tangled black, filaments all inside of this lesion, and it's just
So that might be a good clinical thing for people to be on the lookout for. If you see somebody, that has these lesions that aren't healing right, or they're very, very scarred, scarred up with these
right.
little round cigarette burn looking lesions, to look closer and to look with the proper scope and see if you got any of these filaments in there.
I've seen things though that are, just so amazing. Like we used to have the conferences every year, and the first year of COVID is when it got canceled and sort of never restarted after that. But we'd have naysayers come there. We have, some doctors would come that didn't believe, and we would show them. We would come over, look at this patient, look at the scope, look in there, even showing it right to them. They didn't believe it. And we're like, how do you think all that stuff got in there?" "Oh, the patient put it in there." No. Have you ever tried pulling one of these filaments out? You cannot remove it. I mean, how could anybody stick that in there like that? Or the other thing they love to say is, "Oh, those are just fibers from their clothes." And then we'd say, "Well, do you notice the patient wearing anything black today?" And beside the fact that, these are underneath the outer layer of the skin, they're not just like something that got stuck on there. I mean, it's just so very clear. But it's interesting. Some people just, they don't want to be introduced to a new paradigm. It's just like, I'm happy believing what I believe, so don't upset that. And it's always been fascinating to me. I mean, who wouldn't be fascinated by this illness? Oh my gosh, it's so fascinating. I never, in 25 years of looking at these people and dealing with these people, every day it still amazes me. Every single day. And how could somebody not be interested in that and just discount it so easily? It's just mind-boggling to me. I don't get it.
It really
But, it happens all the time. But here's the good news. There's good news.
Right.
The good news is that more and more doctors are becoming aware and are even telling people this is what they have. But that's where it ends. They'll say, I know that's what you have. I'm not going to put it in your chart. I'm not going to treat it because I don't have a clue how to do it. But that's what you have.
But
Now that's
sometimes just getting that can lead the patient in the right direction, according to you, or to watch the documentary on Morgellons, or to find your book or some of the studies, and then hopefully realize, that a
right.
big percent of this does have an underlying, infectious cause, or at very least an immune issue going on, and then they
Right.
can start, on that road to healing.
So that's big. It might not seem like much, and it actually isn't much considering how long we've been plugging away at this trying to raise awareness and all, but it's different. It's different. When I first started doing this, I'd get calls every day from doctors yelling at me and saying, "What are you're buying into these people's delusions, blah blah blah, all of this." And now the only calls I get are doctors saying, "I know that's what this patient has. What should I do?" And that's a huge difference.
Huge.
I get emails from around the world almost every day, doctors from Singapore, you name it, South Africa, saying, "I've got this patient. I'm sure that's what they have. What should I do?" And thank God we've got, something's happening here because we just need the people who give the funding for research to pay attention.
Get on board.
Yeah, that's what
So is there still a conference? Like, is there somewhere that medical professionals can currently go to, to
I
learn?
think they are planning to restart the conferences. The both patients and providers came to those. Unfortunately, it was more patients. We always wanted more providers to come, but and, even the fact all those patients came, oh my God, it was so healing for them. Just to see, be there in a room full of people and they're all have the same thing. And that goes a long way toward making you feel not crazy. Because when you see that there are so many people dealing with what you're dealing with.
Right.
But yeah, I'd love to get the word out more to doctors, and it's getting out there slowly but surely, and patients are responsible for it a lot. They'll find a kind of a sympathetic doctor that they know will listen, and they'll teach them about it. And they'll tell them. So, and dentists, they're one of the first line people that needs to know about this because one of the biggest symptoms of Morgellons is happening in the teeth. The teeth are just crumbling out of people's heads. They're just hollowing out. I've had dentists call me and say, "What the heck is going on?" I don't know if this thing is leaching calcium or what, but people often end up going to their dentist first. And I was almost gonna speak at a dental conference about this, I was so excited about it, and then they changed their mind and decided, this really doesn't have anything to do with dentistry," and I'm like, that's the point I wanted to make to you. See, I wish if we had research money, what I would love to do is also do, bone densitometries on all these people, to see if there is some sort of calcium leaching going on with this thing. And, just there's so much research we could be doing, but I'm sort of busy taking care of people and I don't really have the time for that kind of research and that runs into money. A lot of these people would have to pay out of pocket for something like abundance optometry. So, as I'm always having about things we should be looking at and things we should be studying. But what I want the most is some really serious researchers. I'm working really hard with somebody else to try to raise some funds so that then we can actually have scientists, serious scientists, present proposals and we can give grants specifically for looking at this thing and what the heck's going on with it. And we already have some people on the sidelines, really highly respected researchers, that I think are, kind of waiting for us to have this funding so that we can really get some of that work done. But we've always been really low on funding. That's a problem.
Yeah.
So
It's funny. I interviewed Kevin Ellis, who's the bone coach, and we had like a really great conversation on the Healing Lyme Summit about, the role that Borrelia plays in
Mhm.
causing osteopenia and osteoporosis by,
Right.
through, remodeling of bone and how Borrelia affects like the osteoblasts and the osteoclasts.
Yeah.
And through inflammation and immune dysregulation. And so I'm wondering if you're seeing Lyme and other vector-borne diseases in that high of a percentage of Morgellons patients, I wonder if part of the dental piece, has to do with, the breakdown of the bone,
Yeah.
as well as, spirochetes living there, like, in sort of like the socket of where the tooth goes into the bone, and what role it would play there.
Well, when they've done research, just basically what bacteria is present in the lesions. Again, that doesn't mean it's a causative pathogen, but they've consistently seen Treponema denticola, which I think is so weird because, that belongs in the mouth. And they're seeing it in these Morgellons lesions. So that's another very puzzling thing. They've also seen Bartonella. They've seen the Lyme spirochete. They've seen a lot of different pathogens when they look.
Well,
But
and that's also a spirochete, right?
right. Hmm. Yeah. Yeah.
So for our listeners that aren't making the connection, so
Yeah.
Borrelia is a spirochete.
Right.
So,
Right.
kind of the same similar pathophysiology.
Yeah. Yeah. So there's it's easy to really want to jump on the bandwagon of thinking, oh, this is it. But I'm very careful about kind of standing back and going, wait a minute. I'm very because I've seen a lot of that with this illness where people just find one thing to be true and then they just kind of go with it. And I think we have to be very careful and stand back and really, really do some very good research before we jump to any conclusions about, what's going on here.
Right.
There's a lot of on the internet, you'll see all sorts of conspiracy theories, of course, so many. And some sound more crazy than others. I often point out to people, like, for example, and I say this in my book, people who swear it's chemtrails. People have been having Morgellons way longer than the chemtrails. So, and there's a lot of the things that they're blaming, and that because I do have, I have this one patient who'd had it for 30 years when he came to me, and his father had had it. And so that was going back to people having it in the late 1950s.
Right.
So the thing is, I think it's been around. It's just been all these people have been very quiet about it because they're always said they're crazy. And this one patient who'd had it for a long time, he said back in the 70s, he went to Mexico to some small village and they totally recognized it. And they called it something like cactus man disease. And so he felt validated because of that, because they just sort of with their country medicine, whatever well, it didn't really help him, but at least they recognized that this was a thing that people get.
Right. Right. And I think just not being ostracized and I guess having comfort in knowing that you're not alone and that other people have this and it's a thing, goes a long way to somewhat soothe the psychiatric piece of it. And I don't
Absolutely.
mean psychiatric in the primary. I mean more of
Yes, of course. Of course. I mean, that's why every time I see a patient for the first time, they'll tell me later, they say, I left that first visit feeling about 50% better
Yeah.
just because I was listened to, validated, that just took this huge burden off of me, and I already felt better just, doing that. And so, gosh, come on, fellow medical providers, that's a pretty easy thing for you to do to make people feel really good.
Just
It
listen.
doesn't require prescription, it doesn't require them buying supplements or anything. I mean, my goodness, just validation for crying out loud. I mean, these people have something and you can't just discount them and call them crazy. I mean, stop and look. I mean, you'll see amazing things if you really take the time to look. And
I couldn't agree more. Tell me what the typical trajectory is for recovery with your patients.
yeah, well, I what I've always noticed is the longer they've had it, the longer it takes to get well. Usually, if they've just started symptoms within the year before they come to me, we're in good shape with those people, relatively recent. And also, it has a lot to do with the age of the patient. My older patients have a much tougher time. Usually, if I get a patient in their 20s with this, I feel real confident that we can get rid of it. So if they're in their 20s, they've had it for less than a year, I feel very confident about that. But, if I get a 65-year-old who's had it for 20 years, I gotta admit that they're tough. But we can always get them better, and that's why I do always tell them on the first visit, "You will get better," because I know they will. I know they will get better. I'm not promising they'll be 100%, but they will get better, and I'm not lying when I say that, and people sometimes tell me, "You're giving them false hope." Well, first of all, I think that's an oxymoron. I don't think there's any such thing as false hope. Hello. you know?
Right.
But anyway, no, I can't tell you how many people tell me once they're well, the fact that you looked me in the eye and said I would get better, that did more to healing me than anything. Because people need to believe it. They need to believe that they are going to get better, and they will get better. It's just how much better I can never really promise, But it's you can kind of tell though by just the age and the general status of the person how um, their general health and a lot of other factors and everything like that. So we do get some totally well. More commonly, I'd say I get people 90% better where they have the occasional fiber or filament fiber and maybe even the occasional lesion, but it's not enough to overwhelm their lives. They can carry on, they feel better systemically, they can go back to work, they can do everything. It's just there's that little nagging thing, they have like this little symptom, but it's not enough anymore for them to get freaked out about it. They're able to just sort of go, oh, just observe it and not have it, ruin their life. And so in that sense, like, okay, it's not 100% gone. It's definitely not. But I just, if we can get people back to living their lives, then that's really what we really hope for. But I have had quite a few, especially the younger ones, get completely well and not have a single symptom of it, for many years after that. So
That's wonderful. And I think that's so important for any of our listeners
yeah,
have Morgellons or who now are going, holy cow, I think I have Morgellons.
right.
I've found some answers from listening to this.
Yeah.
It goes such a long way, and such a long way to helping people to kind of like restore the balance in their nervous system, right? Which is crucial to fixing the immune system and like, being able to heal the body. When people are stuck in fight or flight and they're running from doctor to doctor to doctor to doctor, being gaslit and being dismissed and feeling like nobody's helping them, I feel like the body gets into such a state,
Yes.
that it's like you could give them the best treatment, but unless they know that you believe them and that you can and you will help them, you could
Yeah.
have the best treatment in the world and you might not see hardly any improvement.
I think what you're talking about here is the most important thing, and it goes along with the art of medicine, which is kind of slipping away there through the years. But, I just think that relationship is so important that people feel safe. They feel safe, they feel heard, they feel like this is a place where I can, be me, say everything that's on my mind, that say nobody's going to judge me. There's no judgment here. And that's to me, really not a difficult thing to provide for people. Maybe it is for some people. For me, it's not. I mean, it just goes such a long way, and helping people. So my hope for everybody who has this or who has any illness is to find somebody that can be that person for you. You need to have somebody you really have faith in, and that you can just sort of put yourself in their hands, because it's a lot to have to be out there every day searching the internet. It's so much stress. And I try to get people away from that. Just don't do that anymore. I gotcha. you know, and I've been doing this a long time. I've been researching things. I mean, believe me, you're not going to find anything out there I've never heard of, which they are sure they're going to do. But I say, if I'm not doing something, it's usually because I've tried it, it didn't work for my patients. It's too expensive. There's a reason.
And I
And
think you said the three most important words a minute ago. I've got you. Like, I can't tell you how many times I've said to a patient, listen, I've got you.
right,
Searching, like, your job is to now go calm yourself.
right,
Stop searching frantically. Like, I've got you.
right.
And it goes so.
You're here. You've been searching. You're here now. And I had a patient one time tell me, I was talking about this with a patient, and she said, this reminds me of an expression my dad used to use. He used to say, don't hire a taxi and run along beside it. And it is funny because they come to me, and then the whole time they're still out there searching, and it's like, wait a minute, come on.
Yeah.
We're we're together, we're a team, we're doing this thing. You don't need to keep on doing that. You were doing that before, but let's stop that now, because it makes them crazy. It just makes you crazy constantly. And then you read different things, and you read one thing, it's like, oh, now this is the opposite. And then it's like, so you got to find somebody and just take the leap of faith. I mean, it is a leap of faith, but that's what you need for your own physical and emotional wellness. You just need to find that person, and then just, here I am, take me.
I say this lovingly, but sometimes patients just really need to get out of their own way.
Yeah.
Like, if you want to do something, focus on your breathing, do some guided meditations, go for a walk, like, do things to really, like, help to calm your nervous system and just put that into your body so that you can heal.
Right.
Are there support groups that you can share with our listeners that.
Well, I have an online support group for my patients, and I keep it my patients because I want to serve.
Otherwise, you're treating through a support group, which never goes well.
Right, right. And then, my patients complain that they've tried to get on online ones, but there's too much craziness going on. And so they kind of get off of them for that reason. So I just don't know what to say about that. My patients, certainly before they came to me, have been on a lot of different things they found online. But the complaint I always hear is that mixed in with all of it, there's all the people that believe that, out of space aliens brought this to us, or just all these different things. And it just confuses the picture and makes people even more anxious, because there's just too much information coming at them. So I wish I didn't know. I wish I knew. Well, yeah, I just don't really know of one that I could I could get. Well, I just don't know. I don't know what I ever.
Okay.
Yeah.
So, what message do you want to share with the medical community about Morgellons?
I just, when people come in and they say these things to you, they say, um, please don't be prejudiced, don't just remember that 5 minutes in med school where you learn about the matchbook sign and, you go, "Aha, they're bringing stuff in. Okay, delusional parasitosis, check." No, I mean, pay attention, because you may learn something and you probably will. And so you've got to spend the time, you got to talk to them, and you've got to examine them, for heaven's sake. That's medicine. We have to examine patients. We can't make a diagnosis standing across the room from 10 feet, which is every Morgellons patient tells me that.
Yeah.
That the doctor barely looked at them, barely
Which
even.
isn't that crazy too, because it's like, well, I don't believe you and you're crazy, but by the way, I'm not going to come near you in case you are crawling.
I
Yeah.
know it.
Uh,
I've always thought that
so
too.
hypocritical.
Yeah, it really is crazy. So, but in regard to the biggest worry they all have is that transmission, person to person. And I always tell them, look, I'm your perfect test subject because
Wow.
for years I was in a place. Now my patients are from all over the world, so it's different. But when I first started out, my patients were all local. They all came every visit in person. I've always been a touchy-feely person, so I always hugged my patients and never took precautions. I never took gloves or anything like that. And if anybody would have caught it by now, it would be me. And
Right?
I have not caught it. So I really don't think that person-to-person transmission through casual contact is anything to worry about. But I do tell them, and my patients always say, if I sit next to somebody, I see them going like this. I say, yeah, because you are shedding fibers. They do shed them. And I feel it too when I'm in the office with one that happens to be shedding a lot for 15 minutes after they leave. I'll be kind of, almost like there's fiberglass in the air or something. I will notice the irritation. It doesn't mean they've given it to me. It's
Right.
just the byproducts or whatever are flying out in the air and are irritants. But then that dies down and then I'm fine. So the filaments are not infective agents. That's what they're always afraid of. They're I don't know. I just call them byproducts. I don't know. They're not anything to worry about. They're annoying. They're very annoying to the patient, but they're always quite worried that those filaments are going to cause somebody else to come down with it. Yeah.
So finally, what can you offer, as far as hope or advice or anything that you want to say to patients that might be hearing this and are struggling with Morgellons disease?
First of all, there is hope, so don't give up. Um, Way too many suicides in this group. Please don't give up. There is hope. If you can find a sympathetic doctor that maybe has known you your whole life or something, I will always help at no charge or anything. I will always help that doctor treat you. And I have a lot of people where I'm doing this now, doctor in a small town or something that's been someone's doctor all their life, and they get in touch with me, and then I help them figure out how to treat the person. And that's been working really well because when I go to a conference, I have these people come up to me and you don't know me, but thanks to you, I got well because my doctor contacted you. So anyway, there's that. And then, you know, my book has a lot of suggestions in it too. Unfortunately, I can't take on every single patient in the world, but I currently happen to be open to accepting new patients. It's kind of comes and goes. Sometimes I have to close it down for a while, but right now I am accepting new patients.
So, how would a patient find you if they want to?
They just need to send an email to lymedc@gmail.com. So that's Lyme, Lyme, DC as in District of Columbia, and then at gmail.com. And just ask for new patient information. And we send out electronically a packet of just a lot of basically common question answers, and then the paperwork to become a new patient if you decide you'd like to.
Wonderful. And the name of your book is Morgellons, the
Yeah, it's
legitimation of
right
the disease.
here. Morgellons, the legitimization of the disease. Yeah.
Wonderful. And is this on Amazon? Where
It's on Amazon and it's for Kindle too, so it's the only drawback with Kindle is photographs never kind of are as good, but you can go to my website and I have all the photographs from the book on there in color. So you can kind of really see them better through the website
Wonderful.
if you want to, look at the photos.
Great. Well, thank you so much for joining us.
Well, thank you. You're such a great interviewer. Thank you. Such a
Thank
pleasure.
Thank you. And for our listeners, if you'd like to hear more from Dr. Safely, you can join us at the Lyme Bites Symposium, February 14th and 15th in Pompano Beach, Fort Lauderdale, Florida. And if you can't come in person, you can join us virtually from anywhere. So thank you for joining us for the Lyme Bites podcast. We hope that this brought you one step closer to true healing. And if this helped you, please share it with others that you think need to hear it too, because together we all heal stronger. If this episode gave you an answer, brought you new insight, or made you think differently, subscribe to the Lyme Bites podcast and share with someone who's ready to take control of their healing journey. And if you can, please leave a review. It helps others to find the show. Thanks for listening, and we'll see you next time.